Hi, my name is Cassie Tallon, and this is a course sponsored by Curve and Dental City on optimizing procurement, the role of operational efficiency in dental practices. And tonight we're going to be talking about your schedule and its impact on all facets of how you really order and project for the future the best ways to effectively balance your budgets and also make sure that your team is in alignment in every area. So just a little bit about me. I am the founder of the Fractional Match. I pair fractional workers in the industry, in the dental industry, CFOs, CMOs, COOs on a fractional basis to come in and help dental practices revitalize their workflows. I specifically over the year have worked with many clinics on just creating a better process for the way that they do things. So a special thank you again to Curve and Dental City for the sponsorship of this course. Our objectives tonight are going to be around how to accurately and efficiently schedule and how that can actually help forecast your inventory needs. You'll hear a little bit of redundancy in that, and it truly is because I want to drive home the point that when the front end intake and scheduling is accurate, the rest follows. I want you to evaluate the role of scheduling and minimizing your stockouts and overstocking and really what that looks like. And then implement procurement planning best practices by aligning appointments, and what does that look like as a collective whole. And then anticipate also how to look ahead with that optimization based on reporting structure. So just a lot of exciting information tonight that, again, may seem a bit redundant, but really is about creating an internal strategy that works for you and your team. So let's talk about the role of scheduling within procurement in the dental clinic and what that looks like. So truly what this means is that you are looking at your calendar blocks and holds based on specific material that needs to be utilized. I want to challenge the idea for you that if you don't have a strong inventory setup or controls, for instance, if you were to hire a new RDA, there's almost a playbook of how to set up your operatory versus just someone training. This is now the time to really look at that. I'm going to talk to you about things like having buckets in the ops that are filled with supplies where they can keep grabbing and going and ultimately increasing waste, carts and things that can help kind of eliminate those overages, but just talking about the function of those elements being in harmony and really how they play an active role in your schedule. So the supply chain in a dental practice, for the purpose of CE, we're going to talk about for a moment here, comes from the appointment scheduling aspects of where it begins, the procurement requirements in order to have that schedule, then an inventory management system. Maybe you pull tags, maybe you scan QR codes, maybe you scan, a bin once it's emptied. That inventory management piece, we're going to talk more about that. And then procurement decisions, how you're making those orders based on inventory, maintenance, and what does the frequency look like? How do you prevent rush orders and all of that as well? So let's talk about the procedure-specific requirements as we move into the thought process around supplies and ordering. I want you to first think about categorically grouping the type of visits that you have in the office. So routine checkups, fillings, root canals, crown preparation, implant procedure, maybe new patient is in there as well. What are the specific requirements of your supplies for each one of those categories? What are the things that are actual, setup elements that if fully defined all the way down to the what ifs, you want chair side, floss for every patient, an isolite for every child, prophy, whatever it is, making sure that they're associated with each visit type. So looking at your visit types and itemizing what should be there. So then what this means is once we itemize what happens per type of visit, forecasting those inventory needs through your scheduling data. because now that you've segmented the types of visits all the way down to what you will have for inventory needs, I want to challenge with you this idea that you can actually project your volume of ordering based on your reporting structure. Now, again, for some people, this may seem incredibly too detailed and you don't want to go down this path. I would challenge you to find someone in your office that really does have this heart for making sure that they have the right supplies in the office. I say this all the time. It's your Dave Ramsey cookie cutter person that just tried and true knows that by the book, if they do these certain things, they're going to have the same end result. They cut coupons, they do it in order, right? And oftentimes this is that assistant that just is the very best at setup that I find ends up being your best person for inventory needs. They're the one that can come in here and actually look at when you had the greatest ordering. You can even pull your reports on ordering from whoever you utilize currently and ask them to show you when your peaks and volumes were in ordering and how much you spent, and also identify through that your trends. So if you're having a large order happen right ahead of summer, or your year-end insurance benefits running out, you can proactively start ordering more for those visit types that you feel like need to be front and center for certain times of the year. And then also provider-specific requirements. Not many people, when they're teaching on procurement, divide this up or talk about enough the provider-specific requirements. And I cannot stress this enough. Your provider-specific requirements are so important, especially for new providers. I see a lot of contracts signed and doctors coming on board that have no say in what kind of materials they're given. And they get this ad hoc bundle of existing materials when they only have familiarity with certain things that they like to use. And I really want to challenge you in this. Do they like to use the composite gun and the carpules instead of, something different? Like, this is important to know, because once you do, you can set up their specific needs for restorations and what they want so that your ordering begins to be adequately gauged based on that forecasting. Now, I want to say this, the impact of the poor schedule procurement alignment has far greater reach than you realize, because we think about it in terms of, well, just pull the tags and order correctly. Sometimes it's a lot deeper than that. There is a financial inefficiency because we're rushing shipping costs. Many times the doctor has no idea what the rushing fees are for things like an isolite that end up being almost double the cost of the goods when they have to overnight them. Or, I've seen where they have actually gone to an area office and borrowed supplies and then rushed more to come in to be able to reimburse a nearby doctor. The staff stress of that, trying to balance the ordering and how do we get it right as they scramble for materials, treatment delays. Frequently I see, and it's not talked about or communicated with the team, but there are actual signs where the doctor has had to delay treatment and not known that it wasn't the patient that canceled, but that it was because the team forgot to order something like an implant, and so they've rescheduled the patient without the doctor being aware of the scheduling deficiency. And then overstocking, because of an issue that came about at one point. We operate in almost like a high-low perspective instead of a middle of the road. And by that, I mean, maybe they got in trouble for ordering the wrong thing in the clinic, and now they're suddenly over-ordering. So that can be a massive fallout. It leads to faster expiration dates, greater waste that's happening within the clinic, and then also stockouts. And by stockouts, I mean like full-on emergency same-day order at a premium price, like ordering it literally overnight in order to cause massive, increases in your ordering expenditures. So again, just things to start thinking about fully. So a real-time inventory management means that you're looking at certain deliverables. For instance, what are your top 10 procedures each month? Like I mentioned in the beginning, the identifiable grouping of procedures allows you to say, these are my most common procedures, and these are the variants of what I might need supply-wise for those top 10. Grouping them, color coding, taking photos, making sure everyone on your team has familiarity around what it is you expect for the deliverables per procedure. And then by code, many systems allow you to be able to group by code certain elements and allow you to have all of the CDT codes structured with a specific type of visit. For instance, if it's a new patient comp, everything right down to, patient education, allowing you to have information in that visit about the fluoride, all CDT code structure. And I challenge on this one for inventory management from the perspective of we frequently just associate the CDT code usage with the billable element of what needs to be billed out to the patient. And I like to look at it as your checklist and guide to the most accurate and efficient visit. So then let's talk about the optimization and treatment completed components here. Being able to look at what's tied to that treatment completed and report structure over a 6-month time frame will really help you be able to identify how you should be ordering for your clinic. It's a huge win to look at historicals and be able to order based on what you previously had. So if you look at your last 6 months of revenue coming into the clinic and you did a high volume of extractions, now you know that this type of suction you use for extraction, the type of gauze material, suture, bone graft, all of that needs to be ordered in a certain bulk based on the amount of procedures you accomplished over the last 6 months. And then the optimization gets tied to that, right? That allows you to use your schedule ongoing as really a proactive measure to order either in real-time ordering or month by month based on the projected revenue previous year to this year and looking at what's actually on the books already. So allowing your team to fully communicate about later this month, we have 4 implants coming in. So at the beginning of the month, we're going to go ahead and order the elements for that implant placement for all 4 of those cases. It needs to be ordered by this date, so it delivers by the end of the month. And really that optimization happens through a full communication platform. So the baseline helps you avoid the bottlenecks, and we'll talk a little bit more about that. So I'll just give you some ways that you can simplify. Maybe you're already doing them in your clinic. Maybe you need a refresher, but cassettes are a very valuable element. I think sometimes it's often underspoken or underutilized that a cassette can be a huge win for you. Many times I see offices packaging instruments individually, leading to greater breakage, more difficulty finding the instrumentation, and also just delayed setup. So really that is one way you can ultimately simplify over ordering even instruments through your procurement because of the fact that you moved to a cassette model. I'll also add that needle sticks or sticks, tied to your instrumentation decrease when they're placed inside those cassettes in a protective measure, because it really is about securing instrumentation and putting it together in a way that it's identifiable based on that procedure type. So scheduling by code grouping, I can't suggest it enough. Many times the schedule is placed with a visit there, but there's no elements inside of it on the schedule. That means that there is no true checklist before the patient goes back, and then CDT codes get added on the back end. I'm suggestive of the idea that every type of treatment that you offer should have a set grouping of CDT codes that's placed on the schedule on the front end. It's a huge alleviation of so many things within your office, because it starts the visit off correctly. And then packaged supplies. Many offices talk about this, but I don't think they take it all the way there. I'll give you an example of an office that found a real valuable aspect of procurement was to take a very cheap headrest cover that had the sealable end on it. And for implant cases, they noticed that they were going through about 3 times the supplies that they should because of the things that were grabbed in what should be a sterile environment and just overloading the tray. So they began packaging in a single bag all the elements that were necessary. Highly valuable to consider doing this and even color coding it. I love packaged supplies per procedure because it does so much to alleviate some of the internal chaos. So remember I said that about the buckets. One of the ways I see that, your supplies are going out the door very quickly is in the operatory. There's a large bucket of all the supplies and they're grabbing and pulling and putting it on the trays and going through, 20 cotton swabs when they only needed 2, but they're missing the fact that there was an order to the way that it should be done and really a stewardship of the resources. So packaged supplies, I can't stress enough, color coding them to literally match your code grouping and schedule. So it's like blue crown is on the schedule with these codes, and I have a blue packaged kit that has these elements ready to pull, and I have a blue cassette. So everything falls in alignment. And then team awareness and training. If any of the things I'm suggestive of to you seem far-fetched or you're just not sure if they should work, I would challenge you to first start with a team awareness and ask them the frequency of the schedule having to change from missing materials, the frequency of over ordering or under ordering, and even dissatisfaction with what has been ordered. I see many times where the team tries to cut costs and instead they end up over ordering the wrong things and it never gets returned. So it just becomes an order on top of an order. Start by having some awareness around what's taking place in the clinic and start talking about training together. If you start to manage the waste effectively and bring it up, your team begins to come on board with that because they start to recognize and see the waste. It's just like in a household. If you're starting to notice that food's going to waste and getting thrown out, you sit down as a family and talk about, hey, let's talk about the foods you like and don't like so that we're not over ordering things that end up having to be thrown out. The same is true in dental. Open communication allows you to place the right orders at the right time. And then tracking the missteps, giving an open platform for your team in maybe a monthly meeting or even in just a pulse check to say, hey, where did we miss it this month? What could we do better? What did you not like? An open communication around the things that are important to them. I mentioned this example once before, but in sharing this same training, but, many times team members like a hygienist are utilizing supplies that are less than adequate for what they need. Maybe they don't have elements that are working in their office that need to be addressed. Maybe they're receiving things that aren't good, like they're receiving dental bibs that, 5 out of every 10 are stuck together and don't open, so they end up throwing them away. Start asking your team for feedback, because what you thought you might be saving on the front end may not be actually saving you money in the long run. So an example, an endo setup example would be, looking at, okay, first let's do our code groupings so we have accuracy in the deliverables for the side of not just checklist for the team, but also what's billing out. I included a few codes. This isn't mine to choose for you. I'm just giving examples of the codes that would be included. You could include more. You could include your x-ray codes, anything you want. Then creation of an endo cart. What are the things that should be in your endo cart? Only you as the clinician know this, but to give you an example of how this actual procurement management happens in sync with your schedule is a realization of things like, you know what? We only have 1 endodontic motor and we have 3 doctors. And through our team awareness and communication, we found out that we're not able to schedule 2 endos at the same time because we don't have a motor. And it's happening very frequently. Resolve that by creating per doctor their own endo cart. Yes, there's a little bit of cost on the front end, but the long end return of it is every doctor is able to see more patients and do more production. I frequently see limitations in inventory management as well as supplies like an endomotor or something else being preventative of a multi-doctor, situation where they can't perform treatment. Take a look at that. Ask your team, ask your front desk team, and really become invested in these solutions. And then endo supplies, consider grouping them and keeping them inside of that endo cart pre-packaged. So on Monday, if you know you have 4 coming up, your team member goes ahead and preps 4 kits for endo at the beginning of the week so that all they have to do when the visit happens is pull out the endo packaged supplies and be ready to go. It allows for far less waste. So strategic alignment of your appointments and ordering. I've given you a lot of ideas around this, but really at the end of the day, the greatest thing you can do is go back and sit down with your team and start talking about what needs to happen. So here's some examples of strategic alignment that really can help you with your ordering. Align similar procedures in blocks when possible. Schedule complex procedures that require specialty items around specific delivery dates. Remember what I said, looking ahead for the week, the next week that follows, and proactively creating lead time. Again, open communication, letting someone on your team manage this and asking them where it needs to change. Just-in-time ordering without these stockouts occurring. That very likely may mean that every Monday, your team member is placing an order and looking ahead at what's coming up for the week, forecasting how to make sure that just for this week that they're going to have enough for next week as well. So proactive versus reactive. And then the demand of fluctuation management. If it is the beginning of May, and you pulled reports that show towards the end of May, you have a huge spike in child prophies and fluoride application, your team member is actively ordering. And again, it's assigning this to one person, actively ordering more fluoride at the beginning of the month. These solutions may seem easy, but they're often overlooked, mostly because doctors fall into the category of just day-to-day, running through the motions, trying to get to the next patient, and forgetting to open up the communication. Just an introductory meeting to say, hey, let's talk about what your issues are and how we fix them, because the team will share with you. They'll tell you where the pain points are. They'll tell you if there's been something ordered that's lesser quality than what they would prefer, and they will be a part of the solution with you. So the technology integrations for seamless connection mean practice management systems that integrate the schedule with inventory management. And for me, that is as simple as CDT code structure being tied to the actual scheduling of the visit. Procedure templates that automatically associates the required materials. So like I said, literally code grouping, coloring blue, creating the visit, saying these are the elements of the visit, here's the laminated sheet of how to set up for the visit, and making it seamless from start to finish. It allows everybody to have some skin in the game, and it also starts to create a better workflow overall. Inventory management solutions. There are barcode code scanner systems. Many of you are not utilizing them, but they're provided with whoever it is that's your distributor or resource that you use. So ask about them. There's even cloud-based solutions. The best companies out there like a Walmart or, from the retail side or a Target, they do inventory controls, right? They're checking to see what they're running low on continuously to make sure that they're ordering enough to fill the need of their customers coming in. The same is true with your inventory management. I highly recommend that the same person that actually does your ordering has at least one day a month that they do an inventory management and cleanup, looking for expired elements, looking for waste, really being your waste reduction control, right? They're the officer of all of this. And then data analytics. looking at systems that actually show you your procurement planning based on actual per procedure codes and how you've performed historically. If you can make the link between the actual supplies you order and the visit that you're performing down to the unit, you can make incredible changes in the way that you order for procurement. I've seen many times where I've watched tray setups that the doctor has allowed to be generalized to the point that half of the elements on the tray are never used, never touched, but are just put there out of a redundancy in the clinic. Now is the time to eliminate waste and really become a lean clinic. And most of that has to do with redefining the way your team is doing those setups and doing an adequate analysis of the procurement planning around the type of procedures. It's an investment. It's something I recommend doing over a spring break or even a holiday time frame where you come in for 2 days while the practice isn't seeing patients and put together a once and for all plan that sticks for everyone. And so it really becomes just part of the norm instead of the grab and go philosophy of overuse and waste. It's amazing to know how much is actually wasted in clinics because they haven't slowed down and really looked at the actual procurement process of what's best in terms of setup and support for ordering. So really it means building a responsive team, right? It means first starting off with very strategic communication. And I am suggestive that before you ever assign one person the role of taking over ordering and supplies, that you have kind of a come together moment of all of your team to identify the deficiencies. And then from there, I really want you to think about the staff training, creating an awareness. Hey guys, we're doing this for the environment, we're doing it for the clinic, and we're doing it for your bonus, because the less we spend on having to order more supplies, the more I can give back to my team. Training them to be on the lookout for waste, giving each one of them almost this, the why behind it and this excitement towards the idea that they could be a part of a solution, right? It's the investment in the practice that they didn't even know that they had a chance to be a part of, but you challenged them to look for the waste. And then supplier relationship management, deciding who your suppliers are going to be and really sticking with them. I see, instances where I go into a clinic and 7 or 8 suppliers are utilized and they're never really slowing down to look at pricing or what's in the best interest of the clinic. Now, DSOs have different models and group clinics often do as well, but making sure that you have a preferred vendor agreement that has, flexible delivery, has, flexibility in ordering frequency, and also isn't overcharging you for certain things, such as if you order a certain, product in bulk, you're actually charged more because of those bulk orders on your shipping. And many times I recommend asking for free shipping if you're not under a rush, ordering situation, and most will honor those things. And then just a continuous improvement. What are you doing to regularly review the process and outcomes of what you're doing? That means, again, keeping a pulse on the team. Where did we fail? Where did we get it right? And just continuously improving. So cross-functional communication is all about those regular meetings. It's all about the shared access of data, talking about it as a team. The notification systems, if you have the ability to not just pull tags, but use something like a barcode scanner, or like I said, someone that comes in and does inventory management, creating a better system and workflow. And then just those feedback loops. I have doctors that end up automating a survey. You can do them through Google or Microsoft, where they ask their team recurring pulse checks to just say, hey, are we getting it right? Are we ordering the way that we should? Are we ordering the right materials? And how are we doing this effectively? So the staff training is a massive piece of this, because what it does is it allows you to modify and be enlightened to know things you might not have known before. Like I said, many dentists don't even know that patients are being rescheduled because there are missing elements of the tray setup, or they forgot to order implants for that patient. So schedule staff trainings, having a decision tree made of, what, we can schedule these procedures at the front desk. But if they move to tier 2, which is a denture or a implant placement or an extraction with bone graft, they require someone on the clinical side to schedule those. In the same way, in a medical office, you can schedule intake visit types, but not a surgery. Consider those things moving to the clinical side, because it will create a stopgap in the system that allows there to be a check for the materials needed before the patient actually makes it to the books. Then clinical staff education means that everyone on the clinical team every morning in huddle is covering how they have prepped and prepared for the day and the visits. This is a very big deal to even associate this conversation around, okay, hygiene team, let's talk about your, day-to-day hygiene visits. Do you have enough probing devices for perio charting? Do you have enough of the materials you need for fluoride? And do you have the right materials to deliver fluoride? Asking important questions will allow you to establish greater tracking and also potentially make your orders a little different than you had before. I've seen in huddles or meetings with the hygienists, when we've opened up the conversation for clinical staff education and training, that they're like, that one supply you order, we never use it, but it just keeps coming in bulk. Yeah, because it's on auto reorder and no one knew to turn it off, but the team didn't need it. It's the cutting of waste through the open communication. And then protocol development. Like I said before, this means utilization of codes, color coding, grouping, preparation, and setup before the visit occurs, redefining your workflow down to the point that it doesn't require someone of 20 years to know how to set up that operatory, but that everyone is operating on the exact same type procedure code types, the coloration of what needs to be scheduled. This is the cassette you use, and this is everything in the kit you should use for chairside setup. The teams that have control over those elements, control the controllables, allow for a far greater amount of income coming into the practice, because the doctor is in alignment with how those setups should occur. So the supplier relationship management I want to cover briefly, because this varies from, like I said, GSO, group, or even individual, but making sure that you have preferred vendor agreements in place and that you as the provider or owner are the only one that signs those. Flexible delivery options. I'm seeing more and more frequency of signing on with new vendors and then not choosing the delivery dates. Open communication with whoever you put responsible for your ordering, that they make sure they say the dates and times they want things delivered. Consignment arrangements. I can't stress this enough. If you are considering adding something new into your clinic, like CERAC crowns, please consider utilizing a consignment arrangement to beta and test if there's true value to the equipment before you bring it in. If you're noticing a deficiency in terms of the amount of instrumentation being turned over and cleaned and ready for the next patient, consider just a consignment agreement for an additional statum just for a period of time to test if that actually is the solution. It may not be. It might be that you need someone that's running your sterilization tech with more efficiencies, and that if you have them, you really just need the one statum. But consignment is great for kind of testing in theory what it is you would like to add to the practice without the full commitment. I many times see doctors make purchases of things for the clinic that I truly believe if they would have rented on a consignment basis, they potentially would have never purchased that, very expensive piece of equipment. Just test it first and make sure that it's the right fit for you. And then emergency supply protocols. What are your backup plans with local vendors, and how do you prepare for shortages? Does your team have a list, should they occur, of where they go for those backup emergency items that they can't live without. If you offer sedation, what are the things that you have kind of in your backup stock that need to be there at all times? If you frequently run out at certain times of a type of material that you normally order all of the time, but it's, we consistently or on back order or whatever, it's time to source new vendors and establish protocols to ensure that you do have those things on time. So sometimes redundantly, we stick with the same vendors and just keep going, same day after day, without understanding that they frequently run behind because they don't have that in their distribution center. So it's time for us to source a new vendor that can deliver on time to eliminate the headache of wait. So interactive, discussions that need to happen around this current assessment of your clinic include: how is the patient currently being scheduled and how is it impacting your supply chain? Like I said, right now, are you actively looking at what your setup is for a new patient exam? Or are you filling buckets and operatories where they just grab whatever they need when they want to? Systematically identifying what that scheduling looks like and how it's supported by your supply chain. And then what challenges do you face in aligning your schedule with procurement? I can't stress enough that if you do have software limitations, please find softwares that actually allow you to have perfect day scheduling, allow you to have overlays where you can actually add in those CDT codes to the structural visit before they actually occur. And then fixing the process by saying, we're really going to define what we hope to have in our perfect day setup of what the schedule should look like, so that we're ordering based on the identifiable, structured setup for the next month of what we know we want to schedule for and go after it, versus the reactive, which is we'll just schedule people anywhere we can find a hole, and then we'll try in order to accommodate the need. There's a proactive approach to that with that perfect day. We'll discuss it in more detail later on in the next series, but really that means segmentation of how your day should be scheduled. And then how can your schedule be adjusted to prevent those stockouts and over-ordering? Does that mean that you, again, pull those CDT codes and look at the last 6 months and identify where those headaches are? Because that, to me, is where you really start to see your greatest return, is when you begin to say, how do we help with the prevention? That question, that last one, involve your team. They're going to tell you how they believe that happens. And I think it is so valuable to sit in a group setting and let them talk to you about it, because they're the ones working the front lines, and frequently they have better solutions than you might on what that looks like. So also, looking at the real-time data, talking about what is the optimization in these procurement decisions. What do we need to do to make sure that we have a visibility of inventory levels, what inventory is used per procedure, and make it optimized? There's nothing better than being able to have a practice that runs like clockwork, because everyone knows what's required of them. I will tell you, as you kind of look at these interactive discussion questions and ideas, that many times the frustration and the turnover happening within your clinic is not just because they've received one inferior product that was ordered through procurement and they don't like it. It's because they didn't have open communication that was happening within the clinic around what they needed for success. They didn't have a working piezo. The door was always broken in the operatory where they kept their headrest covers, and it constantly was a headache to try to pull that open and get their headrest covers out. And the straw that breaks the camel's back in that relationship and ultimately decline is not having open communication to say, let's fix and control the controllables to make this the best patient outcome we possibly can. Automation is key. Setting up things structurally in your workflow that happen automatically. And then also, what can you do to better align as a team? What's the communication front office to back office? And like I said, you can just say structurally, these visits are okay to schedule at the front desk. However, If they progress into a more in-depth visit, like an implant, they need to go to our clinical team for scheduling, because there's an identification and an allocation of resources in procurement for ordering before that patient can get on the books. So it's a buffer to keep that schedule from being filled with something and then having a last minute just emergency thought around, oh my goodness, we don't have this in stock, quick reschedule the patient. So I've got 3 case studies here of practices that I've worked with. Again, in the challenge section, just note it's 12 patients per day, not 120. I wish, I mean, that'd be an incredible practice. But an average of 12 new patients daily across all providers, a very large practice, running a lot of patients through their clinic. But procurement was based on monthly ordering, and really what was happening there is they were not looking at the stockouts that were leading to treatment delays. And so they had allocation on the day. This was like an 18 operatory schedule. They had allocation in the day for what they wanted to be on the books initially. But then what happened was the schedule started getting filled because they were doing promotions for Invisalign, promotions for implants, and they were frequently rescheduling those patients because they didn't have the elements in stock they needed. Huge results happened as a result of creating an inventory management system where they had this massive decrease in reduction of shortages, and rush shipping costs were a big piece of this clinic, and an overall reduction in their inventory carrying costs, which is phenomenal. They just started to streamline and be efficient. And then looking at another clinic where the oral surgery group, they had a massive overstocking of implants. I actually worked with this clinic in depth. And again, I've changed the names to protect the innocent because I never want someone to be, ostracized for what they did. But this specific oral surgery group, there was a massive issue with implant ordering, and they had never signed an agreement with the company they were ordering implants from. And so what they didn't know is they were purchasing implants that were non-refundable, non-returnable. So they couldn't even exchange them for another size. And they ended up with a massive overage of inventory. This is real. It's happening all the time. Make sure that you're signing up with an implant provider that actually will allow you to exchange or refund with a system. They have programs you can sign up for, but don't just pick up a book and say, oh, I love these implants, let's contact this distributor and order them, because you need to make sure you have a setup agreement and account with a knowledge of whether or not those things can be returned for you. And then again, gauging the need. Okay, last year, in the month of May, we did approximately what we know over the last 3 years is on average, we do approximately 20 implants in the month of May. Perfect. Now you know what you're going to order based on historical data, and you're also going to sign an agreement with someone that allows you to only order exactly what you need, and you can exchange it if it doesn't fit or you need to have some sort of a component exchanged. So the last case study to share with you is a growing practice. This was an amazing practice that I got to work with. And what they had was this unpredictable supply cost. Like literally you would look at their P&L and be like, okay, wait, like 1 month it's completely out of control, and then the next month there's none ordered, and then the next month it's 3 times greater than that. And what was happening is they had this ebbing and flowing, and the fluctuation was one of the doctors would get consistently frustrated with what was going on, and they didn't have what they needed. And so that head doctor would be reactionary. Then the person that was placing the orders would start to order way more out of the reactionary status, not really knowing what they were doing. And then they would have too much in stock. So there never was a consistent month-to-month ordering. So most of what they were getting in was emergency. This clinic also offered on Fridays, they offered sedation. And they frequently were running out of things for sedation. So they were literally rescheduling one of their most expensive patients with a specialty provider that came in on those days. what you can do is start to predictively analyze how you should be ordering, looking at those procedures. And this clinic is the one that I actually went in and we created pictures of the tray setup to say, this is all of the elements that you need for this tray setup. And we created bags that matched exactly what they needed. And on Monday, for that Friday, we created sedation bags for every single pediatric child that was coming in and put them in the sedation bag, labeled them, and put the color code on them. And we knew that on Monday we were ready for Friday because the bags were already created and everything was set up to go. So the key takeaways from these case studies, these experiences that I had, were proactive inventory management, a centralization and coordination of what you're offering, making sure that everyone has a centralized system based on what actually is occurring in your practice, what do you need per visit, and really creating a formula for that. It's very simple. And somebody said, I don't want to get into the habit of counting my cotton swabs. I'm not suggesting that. What I'm suggesting is assigning someone who is your coupon cutting level employee that starts to put together a formula, an approximation per type of visit of what they really need. And then making data-driven decisions, right? Like historically, this is what we've ordered. This is what I see forecasting for the month ahead. And now we're not making decisions that are emotional responses, but they're very strategic. And then staff involvement. Are you getting your staff involved? Each one of these clinics, it involved talking to the team about what was and wasn't working. In some of those instances, there were significant over-ordering and attempting to rectify situations with a multitude of lower quality products that were just stacking up in the back of the office. And, maybe you have familiarity with this in your own life with Amazon and ordering something that you never end up using that just sits in the package in your house. Imagine the money that is, lost in doing something like that. The same is true in dental clinics. We're seeing this over ordering occurring because they're not really sure what to have in stock and then not returning the excess, which leads to just a huge waste issue in the clinic. So within the next 30 days, I want to challenge you to take away this, scheduling and procurement audit component. What are you currently doing and what is broken? Ask your team what is broken. They will openly share with you the ways you can improve. Procedure templates. Talking to your team about what are the templates for success and what do we need to do? The front desk is going to say to you, I'm always nervous to schedule this, doc, because it always gets rescheduled. Perfect. Let's build out a plan where when it gets to the point of scheduling, it hands off to this person clinically, because we're going to do a review on the back end to make sure we're ready to go, and then we'll allow it to be scheduled. And then creating a weekly review environment. It's my recommendation. I said 15 minutes here. It doesn't have to even be that long. You can associate it with your morning huddle, but just a weekly review and awareness of what's going on in the clinic to say, hey, we finished another week. How did we do? Did we have all the supplies we needed? Any changes, any thoughts? We implemented a new Profi paste. Did everybody like it? Thumbs up. Was it easy to use? Like asking a question each week that gets everyone engaged in the solution so that it doesn't feel like that you're just trying to be cheap and cut out waste, but that you're actively involving the team in what might need to change in order to make the practice run more efficiently. I can't stress enough that even though in the redundancy of some of these points from the CE perspective, I really want you to take away the idea that many times you're in kind of this patient after patient mode, right? Like, I just need to get to the next patient. I just need to stay on time. Asking the poignant questions and slowing things down enough to get a pulse on what's really happening in your clinic will allow you to solve your procurement deficiencies once and for all. And I want that for you. I want you to open the line of communications. I want you to make sure that you have vendor agreements signed so that you're not just operating willy-nilly. I mean, that practice that I mentioned where they had this overage, the oral surgery group overage of implants that could never be returned. those things are really happening because we're not actively managing and being good stewards of the financial spend. So consider starting the conversation as a conclusion to this CE. Consider pulling the way that you've done your visits in the past so that you have a pulse on the trends, and then creating a better method of allowing your team to feel like from the front office to the back, there's a transition of support and everybody knows what's expected of them. Thank you so much for joining. And I did answer many questions on the first CE, but again, if you have any questions, you can always contact me as well.